Hi, UMA students. Welcome to another video on Chapter 2, where we're talking about cultural communication. Today's video is going to discuss how to overcome language barriers and auditory barriers. Now, you might think, I don't have any trouble communicating when I go to the doctor's office. But as we're learning in this week's lesson, the people who come into doctor's offices in the United States are from many different cultures and backgrounds, and we need to always be aware of this and sensitive to these differences. So because of these differences in our cultures and backgrounds, we might also have language differences. Now, when I go into an office, I can communicate fine with my doctor or healthcare practitioner. But some people who speak Spanish or Chinese or Vietnamese or French or Hebrew or Italian or many other different languages, they might have trouble. And so to be effective healthcare communicators, we need to be aware of this and be able to help them through their communication needs. So we're going to move on to our PowerPoint that I have for you all. And let me share that. Okay. So Chapter 2, Multicultural Therapeutic Communication. Now you have been learning about communication in different cultures and being aware that our populations that we serve are going to come from many different backgrounds. One place that some people might be coming from is they might have disabilities. Now, those disabilities can be language related, not just physical disabilities. I'm sure you're used to seeing the ramps so that people with wheelchairs can easily get in and out of doctor's offices or other facilities. But we also need help for people with speech, language, and hearing impairments. The American Disabilities Act, which was enacted in the early 1990s, requires that healthcare facilities, both private and public, large and small, provide effective communication alternatives to people with speech, language, and hearing loss. Speech and language impairments and hearing loss. Sometimes people might have had a stroke and they might not be able to get their words out, which is called aphasia. They might have trouble thinking of what word to use. Or a frequent thing you might run into is someone just with a hearing loss. So your office that you will work for one day can choose the communication method or device that it wants to offer its patients, but the office also needs to take on the expense of the communication device. Now, it could be a person that helps translate information. It could be a sign language translator. It could be an iPad that shows visual images to help someone with a hearing loss. There are many different ways that these communication devices can help a healthcare office meet the ADA requirements, and it's something that you should know about when you go into work in an office. Be prepared to learn about it when you're getting trained so you can effectively communicate with the patients coming into your office. Now, we want to talk more about overcoming a language barrier. Now, you might get an interpreter, which is someone who will interpret what I've said to you in a different language. It might be a human translator, or it could be a telephone or service translator, where they have those phones where if you speak into them, it types out what is being said. But the most popular thing right now is using our good old iPhones or Androids, whatever you might have. And you can use Google Translate, FaceTime, Skype, and there's a lot of different applications that people can sign into. And you speak out in your language what you want to say, and it will translate it for you into another language. And that is a great way to just easily translate information if you don't have anybody else to help you. I know that I've used it when I've been in a store or in another country. My children have used it to help them with their homework sometimes, taking Spanish. So it's definitely a great device and easy to use. Now, it translates information in real time, and it has the ability to translate over 100 languages. So you're really going to catch most any language you might run into. There are some difficulties. For one thing, if you see on my PowerPoint, misspelled the word must. It should say must. Speaks slowly. You must speak slowly when you're using these translation devices so that they can understand what you're saying. And they might have some difficult with medical terminology that's a little bit more technical. So if that is the case, you might want to reword what you're saying so that the translation device understands, and then the patient can understand what you're trying to ask them or tell them. You also might want to document the preferred method of communication in the patient's chart so that you have it for future reference. Moving on, an important person that a medical office could employ or have access to in some manner might be somebody who already works in the office, would be a medical interpreter. Now, a medical interpreter facilitates communication between non-English speaking clients and healthcare professionals. These individuals are trained professionals, proficient in the knowledge and skills of cultural and medical language, and are employed in a healthcare setting. So these people know both ends. They know how to help people of a certain culture, they know their language, they know their backgrounds. They also know the healthcare setting and how that works. So they're very knowledgeable people. They're also very respectful people. They can respect the values of diverse cultures and variations within the healthcare systems and are knowledgeable about both. This knowledge ultimately helps ensure clear communication, which builds a level of trust between the patient and the office so that the patient knows he or she is getting good care and correct care, because the last thing anybody would want is a medical error to take place because of miscommunication due to a language barrier. These medical interpreters are also knowledgeable about the community. They can help a patient if they have housing, food, clothing, childcare needs. For example, let's say someone has to have surgery or long-term care like chemotherapy. They might need help in these areas, and the medical interpreter can assist them in providing community services or finding community services. The medical interpreter can also help filling out consent forms, assessment questions, and provide specific instructions for the patient. They're the go-between. The last thing that we want is something to get lost in translation. We want the patient to know that what we're saying to him or her and what he or she is saying to us is exactly what we want to say and is understood correctly. And the medical interpreter can do that, whether it's verbally or in a written document. These interviews, as I stated before, require cultural sensitivity and awareness of legal and ethical implications. So there's a lot of things to take into account, because as you've been learning, different cultures, they might take their health care differently. So what kind of medicines they'll take, if they have religious beliefs that affect what medications they'll take. So the medical interpreter might be aware of these things and help bridge the gap between the healthcare professional and the patient. All of this helps to increase the quality of care to the patient. And if the aid that the medical provider provides in acquiring a complete and accurate medical history enables a more accurate diagnosis and documentation of the healthcare issues. So it just keeps everything moving very smoothly, and It's really an integral part of a healthcare office to have a good qualified medical interpreter, especially in a city or area where you do have a lot of people who might speak a different language or be from a different cultural background. This interpreter will help promote comfort and compliancy with the treatment plans, which is very important to the overall health of the patient. Okay, I hope you're all getting all this important information. And another thing we want to think about is the medical interpreter guidelines. Just some things to keep in mind when we're working with a medical interpreter. First, you're going to want to brief the interpreter, give them background knowledge about the office if they don't have it, how the office works, how they do their forms, what information the doctor is important for the doctors, and also to make sure they might know the background of the patient and who's walking in so they're not just hit, or blindsided. You want to introduce the client and the interpreter and allow them time to establish a rapport, get to know each other a little bit. You want to discuss the confidentiality. You want to make sure that the patient is comfortable using this medical interpreter and that they understand that everything said between them is confidential, that medical interpreter is part of the office and is going to follow the HIPAA guidelines. You want optimal positioning. You want the patient and the interpreter to be comfortable, whether that's sitting or standing or some other variation, maybe lying down on a table. You want to make sure everybody is comfortable so that you can have the best communication and most effective communication. You want to keep it as short as possible. People's time is precious and they can get frustrated easily. They might be nervous being in the doctor. So you want to be as efficient as possible when the medical interpreter is working with the patient. And if you are the third person in the room, you don't want to interrupt them. You want to let them have their communication back and forth as smoothly as possible. You want to give the interpreter thinking time. You don't want to be asking them a question just after, like if you think of something, oh yeah, we need to know this too. Hold on, let the interpreter do their job, and then you can add in your last minute question. Be aware that the client may still understand English. A lot of people can understand English, they just can't speak it back. It's easier when you're learning a language to learn to understand the language. It's harder to actually speak the words. So you always, no matter what is going on, you always want to assume that the patient can understand what you're saying. You want to be sensitive to their cultural diversity between the client and the interpreter. You don't want to say anything that you regret later. Think about what you are going to say before you say it. That's a very important concept to keep in mind as a healthcare provider. Allow time with the interpreter after the interview so you can go and get the information you need. And use the same interpreter, if at all possible, for follow-up visits. That way you can have consistency, and as I stated before, it'll help build the levels of trust that you're looking for. That's very important to a good relationship between a patient and a healthcare provider. So that brings us to the end of this video. And as always, I wish I could be there with you so that you could be asking me questions in person. But since I can't, you have access to your UMA instructors. You have access to academic services, your textbook, the UMA library, to answer any questions that you might have regarding this video. You might be thinking to yourself that you've been in a situation where a medical interpreter was needed, or that you wish you had one. Maybe it's something that you could ask for in the future if you or a family member needs someone like that at a doctor's office. Regardless, I want you to take some time to reflect on the information that you learned today and use this information when you do the rest of your week's work. Use this content material in your readings, the interactives, and the other course room information, as well as research on your own and the UMA library to maximize your learning. This information should hopefully help you with your assignment and your assessment and your discussion posts. And I had a great time talking with you today. Have a good night. Thank you.